everyone, and welcome to another episode of Be a Nurse, They Said. My name is Lainey, and I'm so happy that you're here. If you have not gotten the chance to yet, make sure to hit that subscribe button so you can stay up to date on all things Be a Nurse, They Said. This week, I'm going to talk about how to properly use AI when you're in nursing school. AI is here, and it's not going away, and it's only going to continue to grow. There are correct ways to use AI when you're in nursing school, and I want to give you some tips on how to do that. This way you can stay ethical and also make you a stronger nursing student. Nursing is a profession built on integrity, so it's important that you stay out of academic trouble. So, ways to use AI that can help you grow as a student. First, AI can help you brainstorm ideas for papers or projects, and it can help you organize your thoughts if you already have an idea. Another way it can help you is to help you understand topics. AI is very good at breaking things down into simple, easy to understand forms. This may help you explain medications, explain lab values, explain the patho behind a disease, but it'll make it a little easier for you to understand. It can also help you compare different diseases. So for example, if you're learning COPD and you need to know the difference between emphysema and chronic bronchitis, it does a really good job of putting them side by side and breaking them down so you understand the differences. Another way AI can help you is that it can help create practice questions. It will give you practice questions, it will tell you the correct answer, and it will also give you a rationale at why that answer was correct. It can also help you create flashcards to help you study for your exams as well. The key point here, though, is that you always have to check the information that AI gives you with your notes or your textbooks. This will ensure that AI is giving you correct, accurate information. Because if you're studying the incorrect information, you're going to use that incorrect information on your exams and potentially get questions wrong. Another way AI can be useful is for writing support. It can help you if you're having some grammar issues. If you know what you want to say and you write out a sentence, it can help you make that sentence sound a little more professional and a little more touched up. Just make sure that they are your own sentences and not sentences you got from somewhere else. AI is also good at improving the flow or the tone of something that you wrote. So like I said, that if you want something you wrote touched up, you can put that into AI and it gives you a little bit more of a polished version of what you already said. A key point here is that AI should not be writing your papers for you or be replacing your own clinical judgment. I will say that professors and educators can tell when it is not your work that you submit. The last thing AI can be beneficial for is patient education. Like I said before, AI can break things down into very simple, easy to understand things. And when you want to avoid a lot of that medical jargon, so patients with no medical background can understand what you're telling them, AI can be very beneficial. It can adjust to different reading levels because every patient is going to have a different knowledge level and a different reading level. And like I said, it can just make it a lot easier to understand and present the information to your patients. A couple things of what not to do. Like I said before, do not use AI work as your own. They should not be writing your papers or creating your projects for you. They can polish them and make them sound a little better, but they should not be doing the work for you or replacing your clinical judgment. When you get information from AI, if they give you resources, please do not just copy and paste those resources into your work. Make sure that you are checking the sources because there have been times where AI has given resources that do not actually exist. For example, journal articles that do not actually exist. So make sure you're going back and actually checking those sources, journal articles, expert opinions, whatever AI is giving you, make sure you're checking the information for accuracy. And then obviously you should not be using AI during your exams. I know most exams are in person, but if for some reason you're taking an at-home exam, please do not use AI to do the work for you. Actually take the time to learn and take those exams because it's only going to make you a better student in the long run. As I said before, AI can be very beneficial, but it's important to use it properly. This will avoid academic integrity issues, plagiarism, and unsafe practice. So use AI to your advantage, but don't forget to check the facts. I hope these tips on using AI in nursing school were helpful for you. Please comment below and let me know your thoughts. Don't forget to like this video, subscribe to my channel if you have not gotten the chance to yet, so you can stay up to date on all things Be a Nurse They Said. Also be sure to check out my TikTok and Instagram account where I post other shorts and updates on my channel. And as always, don't just be a nurse, Be amazing like I know you all are, and I'll see you next time.